Hello, everybody. Andrea Twarowski here from Dentalelle Tutoring. So some of you have been asking, how did I become a restorative dental hygienist? So I'll tell you about kind of how that happened, because actually that was not something that I ever thought about doing necessarily. My main mission was to become a dental hygienist since I was probably age 10. It could have been sooner. So I became a dental assistant first. I became a dental hygienist after that. And then probably about 5 years after that, I decided to become a restorative hygienist. And I've been doing that now for a couple of years. And if you're curious how I became a dental assistant and then a hygienist, I do have that in a video that I did last week. So feel free to have a look. But a restorative hygienist, so depending on where you live, you may not have heard about that ever before, because depending on where you live, that may not be something that's offered to you. In Ontario, there's only about, at least when I graduated, I looked online and there was only about 516 of us, to be exact, that were actually restorative hygienists in Ontario. So that's not a lot. That's not a lot if you think about it. But the nice thing about being us is that we can do a little bit more. So you might be asking, well, what can you do exactly? And what's the difference between a restorative hygienist or a hygienist and then being a dentist above that? So think about it this way. We cannot prep the tooth, okay? So we still can't give local anesthetic and we cannot prep the tooth. But when it comes to doing, say, a composite filling or an amalgam, we can do everything else. So the dentist still has to come in to give the local anesthetic, and then they still have to prep the tooth. So they have to take out the actual cavity, and then we come in after that to put the filling in, to polish it, to do all of that. So I guess you could say that the dentist sees the patient first, and then the restorative hygienist comes in after that and then sees the patient until the end. So we're able to check if the filling's too high, we're able to polish it, we are able to change the shape, but we can't touch enamel, if that makes sense. So if we had to change the shape of the enamel, oops, I just saw something on my shirt. If we had to change the shape of enamel, we are not permitted to do that. But to change the shape of a composite or an amalgam, yes, we are able to do that. And we are also able to adjust night guards. We can place temporary crowns, temporary bridges. We can make a temporary crown. We can make a temporary bridge also. We can cement permanent crowns. We can cement pretty much anything permanent. We can take final impressions that other than us, the dentist is only able to do. So we are able to do that. We are able to do ortho also. We can't do the assessing and the planning, but to place everything, we are able to do that. So I'm a little bit hesitant to tell you what we're able to do, because it does depend on where you live, and it depends on the training that you have also had. Like, for example, if I were to place ortho, I haven't been trained on how to do that. I can, but I would not feel comfortable placing it because I don't know how, because I haven't been trained. But if they show me how, then I'm able to do that. Like, that is something that I am allowed to do. Whereas, let's just say the dentist trained his dental assistant to place ortho. She cannot, because she is a dental assistant. You just have to be something else. So dental assistants aren't able to do everything. Even if you're trained on something, it doesn't mean you are allowed to do something. Does that make sense? But on the other side of things, I would not feel comfortable placing ortho because I haven't been trained, but I'm able to do that. What else? So that's just kind of the difference. Now, a question that a lot of people ask me is, well, can you find work as a restorative hygienist? Because this is something fairly new still, and not a lot of offices have even heard of it because you're not able to do it everywhere. And to pretty much be a restorative hygienist, it means that the dentist preps the tooth, he still does the local anesthetic, but then he says, okay, the rest is on you. So that's amazing. That is a good thing. But if the dentist isn't used to that, that's not something that he or she will want to do. There's an office that I worked for a while actually, and he loved it because he said, well, I would prefer you doing the easy stuff while I focus on, taking out teeth, doing dental implants, doing surgeries, so he was perfectly okay to let me do the easy stuff, if that makes sense. So he just loved it. But then I've talked to dentists also who have said, well, I've been practicing for 20, 30 years, so I don't feel comfortable letting a restorative hygienist do the work on my patients, so everybody sort of feels a little bit differently. It would be nice if we could just do what we're taught to do. It would be nice if we can simply do what we're trained to do, but not every office knows how to utilize us. And another thing is, so some people ask me, so why would I go to school to do that if it might be hard to find a job afterwards? Well, that is totally up to you. I went to school for it initially because I was working for an office where I had been there for at least 12 years. And he had said to me, hey, like, I need help. Have you ever thought about taking this program? Because you could help me with a lot of the things that I just don't have time to do, nor do I want to do necessarily. He was saying like, well, I would be happy to let you do all of the composites and all of the amalgams so that I could do other things that make me more money, plain and simple. But he's only one person. So he's like, I can only see one person at a time. But if I had you to help me, I could see 2 or 3 people at a time. So that is how it's a lot nicer. And it does help to make the office money, because what I used to do was we would have 2 or 3 rooms set up at a time, usually 2, 3 if we happen to run behind. And what would happen is we would see a patient, say 9 in the morning. The dentist would come in to give local anesthetic, and then he would prep the tooth, and then I would take care of that patient. And while I am taking care of, let's say, patient number 1, he would start patient number 2 that would be seated in the next room. So he would give the local anesthetic and then prep the tooth for patient number 2. And then by the time I was done patient number 1, I could move over to patient number 2. So as you can see, you're making twice as much money because you are able to see more people, and things are a lot easier for them because they're like, oh, okay, well, all I had to do was give the local anesthetic and then prep the tooth. Well, now, while she's doing the rest, I can do something else, so they love it. Once they know how to use one, they're like, wow, this is the best thing ever. So it is the most amazing thing to be a restorative hygienist, because people love us. Once they're able to use us and they know how, they're like, wow, this has made my life so much easier. But I will say this, if you don't have the in with an office, it may be harder for you to find work because it still hasn't caught on as quickly as we would like. Like if an office hasn't heard of us, they will not say, oh, okay, well, I'll pay you twice as much to be a restorative hygienist. Okay, sure, but I don't know how to use you. So I guess you can polish fillings sometimes, you can do this, and then we'll kind of go from there. That doesn't happen because we do make a lot more, as we should, right? Because we are doing a lot more. We are like a dentist, but not quite. you know what I mean? We are like a mini dentist, but obviously not quite, because they can do a lot more, but we can do a lot more than just a regular dental hygienist. So we should get paid more. But an office isn't going to pay us more if they don't know how to use us. So that is something that we have to slowly sort of bring more into offices. You know, if you're looking for work and they're like, oh, you're a restorative hygienist, well, we don't really know what one is. Say, you know what, I can help you with that, because as soon as you have me, you will be like, wow, things are so much easier. We can see more patients, we can make more money. We can see people a lot sooner than having to say, yes, you have a cavity, but it's going to be 3 months before we can see you because we are fully booked. And no office, or I should say no staff member, wants to work full time, at least not these days. You may want to, but I know a lot of us don't want to work like 10 hours a day every day. So, you know, hiring somebody like me would mean just, it's a lot easier for offices because you can see more patients. You don't have to be working 10 hours a day. Like 8 hours a day would be enough, or you could sort of switch things around so you're only doing a couple evenings, not every single evening, because as we know, we have to do sort of what's easiest for the patients. If they're able to see us in the evening and that's it, well, we need to be open the evening hours because that's how we make the money. But having a restorative hygienist is just so much easier for everybody. So I guess I should say, so the course, again, depending on what school you go to. I went to a school in Ottawa where the course was about 9 months in total. It was an online course, which is amazing. I loved that. So the course was online, but we did have to have clinics in Ottawa for 2 months. So we worked really hard. In clinic, we saw actual patients. It was insane. Oh, I just saw a cop car, you guys. Ooh, that's interesting. Wonder what that guy's doing. Sorry, guys. Anyway, I was just looking at the cop car there. That's weird. We don't see that around here, so I was just kind of looking out the window. But anyways, so my course was 9 months in total, with, I said, the 2 months in clinic in Ottawa, but it was tough. Oh my God, it was a tough program. I'm being honest, you know, like, oh my God. The online theory portion wasn't that tough because I was excited to learn it, so I didn't mind it. But I had not been in school for like 5 years. So having to study for tests again and, you know, to make sure to pass, because if you don't pass the theory portion, you don't move on into the clinical. So, you know, your money that you spent was a big waste. And my course was about $10,000. Yes. So for a 9-month program, it's expensive, depends on the school where you go, but mine was $10,000 for a 9-month program. Wow. And then we had clinic, and we were literally in clinic from like 8 till 4, like 3 times a week, but it was hard. It was brutal. They tested us. They made sure that we knew everything. Oh my God. I'm so happy to be out of school. Let me just tell you that. But it is obviously worth it. Like, that's how you learn, right? Like, that's how you learn. But yeah, it depends on the program, because there was another school in Toronto that their program was all year, but only a couple times a week. And I don't live in Toronto, so that did not make sense to me to, you know, have to wait a year to pass. And it was only a couple times a week. So I would either be traveling back and forth, which no way, or I'd have to move there for a year. So instead, I moved to Ottawa for 2 months, you know, and that's it. I came home and I was all set. So yeah, that was pretty intense. But so is it something that you want to do? You know, that just depends on you. You may or may not find work afterwards because it's still not widely known, if that makes sense. But, you know, you do make a lot more, and it is exciting. Like, I love it. So if you're, let's say, a dental hygienist now, and you're saying, well, I kind of would like to do something different, but obviously still have my same skills, just a little bit more. It's a 9-month program, maybe a year extra, but it's $10,000. It's a lot of money. I'm assuming for the year program, it's probably more. So yeah, so that just depends on you. But am I happy that I took it? Yes. Do I work full-time doing it? No. But I don't want to work full-time either. So I'm not the type of person where I have to work full-time, thankfully, nor do I want to, because I tutor pretty much full-time. So I am perfectly fine doing restorative hygiene once or twice a week, but that may not be enough for some people. So I don't know a lot of restorative hygienists who do work full-time simply because it's not that well known. So just things to think about. But if you guys have any questions, just feel free to comment, because this isn't something that I kind of thought about talking about, but I was like, well, people have been asking me questions, so I guess I should talk about it. So if I left anything out, please let me know. Just feel free to comment on the bottom, and I will answer you back as soon as possible. Talk to you later.